Ready when you guys are.
My sophomore year of high school, my school decided to put on a high school blood drive. And we went through the American Red Cross. And a lot of people in my class were really excited because you have to be 16 to be able to donate blood in Missouri. So we had a majority of my class, except for about 3 people, turned in their forms to donate blood. And we thought it would be a great experience. One of my friends, Ashley, decided she was going to donate blood. She's really little, always happy, very bubbly, great personality. You never see her not smiling. And she went in to donate blood, and what happened was something similar to this. They dug in her arm for a vein, and they couldn't find one, and it was actually a lot worse than this. It was her whole bottom half of her arm and about up to here on her top half. She had prom 4 weeks later, and the bruise still wasn't gone, so she had to go buy gloves for prom that went up to her shoulder almost to cover up the horrible bruises. And after that, she never wanted to donate blood again. So, how many of you know about the Red Cross? All right, how many of you know about the Community Blood Center? How many of you have actually donated blood to one of the organizations? There's a significant difference between which organizations you donate blood to. According to FDA.gov, 15 million units of blood are needed in the U.S. a year. So that's about 15 million times 3. That's a significant number of blood that you need. And so I've been donating blood since I was 16, and I've organized several blood drives, and I've been offered positions in different organizations to help other schools organize blood drives because I do it so effectively and I reach other students across the campus. And the problem that we have today is that blood donations are scary to most people. You don't want something like this happening to your arm. It's terrifying. It looks hideous. A lot of people are afraid of passing out, which isn't a big deal. It's a very small number of people who actually pass out. And schools are terrified to have their students donate blood because they're afraid that they're going to scare off students from ever participating in anything. So giving blood should be a good experience, and that's what makes the Community Blood Center so different. These are my 3 main points I'll talk about today. How the Community Blood Center is a reliable place to donate blood. They supply blood to local hospitals, including the hospital here in Warrensburg, and they donate for the needs of your local area first before giving to other countries or other states. Now, according to Cheryl Osborne, who is the community director of the CDC, or the Community Blood Center, 99% of the Community Blood Center collect the blood that the Community Blood Center collects stays local. So when someone donates blood, they can know that their blood will possibly go to someone here in their own community, which is a really reassuring thing, especially if something bad happens to your friend, you know that your friend is definitely taken care of with blood that you know is local. The Red Cross gives money and blood worldwide instead of staying local. They take care of more like disaster in Haiti or disaster tsunami relief before they decide we need to help the United States. So the Community Blood Center is a lot more reliable just because the blood stays local before it goes to other states or even other countries. I'm not saying that the Red Cross is a bad organization. It's a great organization, especially for relief efforts, but I like the Community Blood Center better because everything that you do stays local. Last year, according to the Community Blood Center website, they provided 134,000 units of blood to local hospitals that year. And the Community Blood Center isn't as well known as the Red Cross. And these are some statistics that I got from the Community Blood Center website. Every year in the United States, around 15 million units of blood are needed. And last year, only about 12.5 million units of blood were donated through organizations like Pacific Blood Center and Community Blood Center and Red Cross. And then less than 5% of eligible donors in the United States actually donate blood. Major reasons we need blood. It's used by cancer patients, such as patients with leukemia, heart and blood vessel diseases, diseases of the gastrointestinal tract, and in emergencies. Say you get in a car accident, you need about 50 units of blood. You need a heart surgery, 6 units of blood, and 6 units of platelets. You need a heart, 40 units of blood, 30 units of platelets, 20 bags of cryoprecipitate, and 25 units of fresh frozen plasma. Plasma can stay fresh frozen for over, it's about, I think they said 26 months. They usually only keep it on the shelf for 24 though, in case it goes bad or there's a contamination problem. They do over 17 tests on blood to make sure it's okay before they donate it to anyone. 11 of them are for sexually transmitted diseases and blood diseases alone. And since I have your attention, while you're reading this, someone in America needs blood now. Blood is needed every 2 seconds, and about 1 in 7 people entering a hospital needs blood. And that's from the SaveALife.org. Then 10 pints is about the amount of blood that the average human adult has in their body. And if only 1% more of all Americans would donate blood, there would be no blood shortages in the United States at all. Just 1% more, that's 6% of people just donating blood. That's not a big amount at all. A patient can be forced to pass up a life-saving organ if the compatible blood is not on their shelf. So I don't want to scare people, but there's a lot of rare blood types out there, and a lot of people don't want to give blood. And so you're possibly, if you have a rare blood type, you're telling someone you can't get this organ that can save your life because you didn't donate. So blood centers often run short of types O and B, and they're the most common blood types. And there's no substitute for human blood. I looked for research about synthetic blood, and they can't even start doing that. They can make some sort of synthetic platelets, but those have to be cycled, and they're not compatible for human bodies yet. Children can be treated for cancer, premature infants, and children that are having heart surgery need blood and platelets from donors of all types, but especially O, because O is the universal blood type. So these are the reasons why I think the community blood center is a reliable place to donate blood to. It stays local, it stays where you are. It helps the community around you. And they supply blood to local hospitals first before going to other states. So we don't have a blood shortage before someone else does, and we don't have any blood then. And it provides for the needs of the local area, which is always important in case there's an accident. So just remember, I encourage you to use the CBs, to use the community blood center when you donate blood. It'll stay in your community and it helps impact it. And I know for a fact that the university uses the community blood center whenever we give blood. So keep that in mind, and we have a blood drive next week, so I encourage you all to go out and donate if you're eligible. Thank you.